The blood pressure we measure has two numbers. There's a number written on top, which we call systolic blood pressure, and a number written below, which we call diastolic blood pressure. In a normal person, we express blood pressure like this. We say 120 millimeters of mercury over 80. Systolic blood pressure means the pressure when the heart is in the systolic phase. As you know, the heart has two phases, the systolic phase and the diastolic phase. Systole is the contraction phase, or the phase when the ventricles contract. In this phase, the ventricle contracts and pumps blood forcefully into the aorta. In the systolic phase, the mitral valve is closed and only the aortic valve is open. Imagine the ventricle as a room with two doors. One is an entrance door and the other is an exit door. The entrance door is the mitral valve and the exit door is the aortic valve. So during the systolic phase, the ventricle contracts. The aortic valve is open and blood enters the arterial system. And because the aortic valve is open, the pressure before and after the valve is equal. And the pressure in the aorta is equal to the pressure in the left ventricle, according to the law of communicating vessels. Just as the pressure in the left ventricle during systole is 120 millimeter meragwag, we expect and anticipate that the aortic pressure during systole will also be 120 mmHg. But during the diastolic phase, the aortic valve is closed. This means that the two sides of the aortic valve are not connected to each other. That's why the pressure before and after the valve is not equal. For this reason, during diastole, the pressure in the left ventricle is 0. In contrast, the pressure in the arterial system that we measure is 80 millimeters of mercury.